What is fentanyl? Fentanyl is a synthetic opioid that once it binds to a receptor, it blocks pain. It also floods the brain's reward system with extra dopamine, which then causes a sense of euphoria and relaxation. Fentanyl suppresses the brain's ability to detect CO2 levels, which can potentially cause a person to stop breathing. The side effects include dizziness, chills, vomiting, fainting, and extreme constipation. Fentanyl can also cause severe side effects that require medical assistance, such as changes in heartbeat, hallucinations, nausea, vomiting, irregular menstruation, loss of appetite, seizures, and hives. In addition, fentanyl is much more stronger than other opioids. Fentanyl is about 50 to 100 times stronger than heroin. And it can be absorbed by the body through the use of skin patches, injections, inhalation, and swallowing. Skin patches are the most common. Fentanyl is used to treat cancer patients, and it is also used as an anesthetic and surgery premedication because of the advantages that it has of being a fast-acting drug. About 21 to 19% of prescribed patients use fentanyl, and from this, about 4 to 6% eventually switch to heroin. For most drugs to work, they need to pass the blood-brain barrier, which allows fat-soluble non-polar molecules to pass, such as fentanyl. Since fentanyl is a highly lipid-soluble molecule that can be absorbed through the skin, it passes the blood-brain barrier quicker, within seconds. The lethal dose is 2 milligrams, which is about 2 grains of salt in a test tube, which then poses a great risk for overdoses. Drug overdose is increasing in North America, about 65,000 deaths in 2016. Naloxone can be used on someone who overdoses on opioids by blocking opioid receptors. As the danger increased, doctors began to decrease the opioid prescriptions, which didn't turn out the way that they were hoping, since it led the now addicted user to seek the drug in the illegal market. New approaches should include safe consumption sites, which is where people suffering addiction can be supervised, and it would minimize the risk of overdose. It should also include anti-withdrawal drugs and counseling to help those who are addicted to fentanyl.